My name is Eric Sorenson. I'm a neurologist at the Mayo Clinic in Rochester, Minnesota.
Hi, I'm Brian Crum. I'm a neurologist at the Mayo Clinic in Rochester, Minnesota. I work in the EMG lab, and I also specialize in neuromuscular disorders, including ALS, or amyotrophic lateral sclerosis.
When I was in medical school, I first became interested in neurology for a number of reasons. And I started working in a lab, doing research in the lab with Dr. Tony Windebank, who is a basic science researcher in ALS and motor neuron diseases. And I was also a baseball fan, and I think one of my early exposures to ALS was, like many people, is through Lou Gehrig and his story. I saw The Pride of the Yankees. And it's a fascinating disorder. And this is really, from a biological standpoint, it's fascinating. And when I first went into medicine, first went into the field, I was convinced by this point we would have figured it out. At the time, they were making significant gains in understanding the biology of the disease and have continued to do so. But it's frustrating for me as a researcher that it's gone as slow as it has. I can only imagine how frustrating it is for patients who it seems like it crawls at a snail's pace. But that's really what drew me into the illness. The biology of it is so fascinating. It is really just fascinating.
How I was interested in ALS, I think certainly from the EMG standpoint, because that is such a crucial part of the diagnosis. That here at Mayo, we certainly see a lot of patients with that referral diagnosis because we do have a very active and busy and good EMG lab that can help make that diagnosis. And also importantly, sometimes do an EMG that will find an alternative diagnosis. So I think that's obviously one of the more gratifying things, is to have a patient coming in with the diagnosis of ALS and actually finding something else. And one of the main ways to find something else is with an EMG study that points to another alternative diagnosis. So I think in the EMG lab, it's very interesting seeing these patients trying to search for those other things. And then I think just in terms of being able to offer something to patients that may not be a cure, but also be really involved with their care from kind of start to finish, knowing, having the knowledge of what kind of complications they may run into and what kind of things to think about before they get into those complications to try to maximize their quality of life. So I think all those things really made it very interesting for me to get involved with that. And again, like I said, I do believe that someday we will have a much better treatment and maybe a cure, and obviously being part of that will be an extremely gratifying part of my career.